Hi there. My name is Red. I appreciate you joining me today. I wanted to take this time to go over the a couple different subtypes of parental loss, because I felt that it was necessary to cover the perspective beyond death. So, losses involving the absence of a parent, regardless of the nature of that absence, hold equal weight. And I wanted to make sure to address those to the best of my ability. I got into this project because I would like to go on to get my Master's of Social Work. And following my that, I would also like to go on to get my LCSW. Mainly, I received a lot of benefits from being able to access low cost or free counseling services. So that's the population that I'd like to serve. But given this, that also means I need to diversify my understanding of a large array of experiences. So, of the three subtopics that I'd like to go over, I'd like to go over absenteeism, estrangement, and I am going to go over death. I did want to split those up into a couple different subtopics. So let's go ahead and get started. So to start off with, I'd like to showcase a model of Yuri Von ecological systems theory of psychology. So this theory discusses how the different levels of interaction shape an individual's identity, particularly a child's, as they develop, and how those different combinations can lead to completely different outcomes for individuals, even in the same setting or in similar demographics, even. So you can see here, beginning with the microsystem, which is the most direct interactions with a child. You can see the mesosystem, which are how those microsystem factors interact with each other, and then how proximal factors interact with those micro interactions, surrounded by the overall larger factors such as economic status, political status of the area, um, religious ideologies in the area, and geography. So first, I wanted to go over absenteeism. There's oftentimes this idea that children have that parents need to be perfect, but parents, as we know, are people. They go through their own struggles, which then in turn affect their children. Um, Dr. Marion Little describes how obviously parents don't need to meet a specific standard, only the standard of recognizing the need to meet a certain level of relationship with their children, meaning the ability to change and grow according to their child's needs, providing consistent love over time. For the purpose of this section, we're going to go over a couple different subcategories of absenteeism, getting started with addiction. Firstly, I wanted to offer up a quote from a study of the Current Drug Abuse Review in 2013, which offers some further perspective as to ecological systems theory related to drug addiction. Um, Essentially, there are a lot of interrelated vulnerability factors. Um, and it's because of those interrelated factors that there needs to be a greater level of study into relative risks of children based on these differences. So, for example, as cited in that study, there might be a very significant differences caused by differences in socioeconomic status among children of addicts. Are one or both parents affected? When did the parents become addicted? Was it very young, when the child was very young, or did the parent, maybe become addicted when the child was a teenager due to something like opiates prescribed because of back surgery? Um, and whether or not another primary factor, as the last one here, whether or not the substance abuse led to maltreatment at the physical level. Did it lead to neglect in some way? Did it lead to physical abuse? Or was it simply an absence factor? Now, there can be even more breakdown from this as far as the variances in child situations. You can have children who, two different groups of children, both groups of children have parents that suffer from alcoholism. But depending on if it's one parent, both parents, and the marital status of their parents, the socioeconomic status of the family, those things might create vastly different outcomes in children. Now, this is obviously so far I've only covered a handful of scenarios. There are a number of individual factors, even more so than this, which might more affect the situation. Um, and in an alternate study, it was important also for me to note that the variability of these outcomes can manifest in how the children cope on a day to day basis. The child might have no issues completing school, but have issues forming trusting relationships with people. Or they might be more inclined to take on further adult roles than would be appropriate for their age group. Maybe they provided more emotional help to the parent that was not addicted in the situation or cared for the parent through their addiction. Those would create different outcomes that would merit a certain level of therapeutic process. And I did previously refer to only substance use disorder, but it is also important to account for the different behavioral addiction factors that might arise. Um, a parent might struggle with shopping addiction, work addiction, screen time, or even exercise might cause similarly adverse effects in children. So, what are some important considerations that mental health providers or future mental health providers might be able to offer? Um, Primarily just asking children about their specific situations, asking about their viewpoints would better allow for accommodating their needs. Um, Being sensitive to the fact that some children who may not be experiencing things like neglect or physical abuse might not be eligible for legal intervention. So they might be quote unquote stuck in a situation, and the best support that they can receive is at the interpersonal, at the therapeutic level. Um, and lastly, there does need to be more investigation done into how the different types of addictions manifest. So, in terms of behavioral addictions, there is obviously now greater opportunities for screen addiction, given the amount of time that we spend on screens on a daily basis for entertainment purposes, for work, and otherwise. And when that becomes an addictive habit, that warrants the need for examination, but there isn't a lot of available literature surrounding the impacts of these new behavioral addictions. As far as maternal absenteeism, I did want to initially go over some of my overview findings relative to the data pool that I was able to grab for this overview. Um, Mainly, when I was going through the research, there is a shockingly low amount of studies under the labeling of maternal absenteeism compared to maternal abandonment. And the distinction that is made within these studies is that absenteeism is attributed to maternal figures that are in the workforce versus abandonment is the total absence of these figures. Um, and this also fails to account for sort of these presence absence factors. That might be something like the aforementioned screen addiction, depression, or emotional unavailability, where some of those can be combined factors. Now, on the topic of emotional unavailability, I did want to bring to light the still face experiment by Ed Trotnick. You could see in this slideshow, the mother is showing at different points a lack of emotion, which is causing the infant distress. And the initial purpose of this study was to review the effects of maternal depression, of post partum depression. But in this case, it's still applicable as far as emotional unavailability, and in particular, emotional unavailability related to smartphone usage. There have been some existing studies done related to maternal smartphone usage. There does seem to be literature supportive of changes in infant behavior similar to the original still face paradigm as far as parental smartphone usage goes. And within these instances of distress, children too tend to, um, in prolonged cases, develop significant repercussions related to lack of attentiveness from their parents. As far as some of the more severe repercussions, the complex PTSD Foundation does describe quite a few of possible outcomes. Children might not be as heavily supervised in precarious situations as they should be. Other adults in the household might be physically or sexually abusing the children, and the absent mother is present in the household but does nothing to intervene. The mother is emotionally abusive, but physically present with the child, doesn't offer correct nutrition for the child, or maybe neglects child needs even though she's physically present. Now, there are have been some cited cases, and there are some studies as far as total maternal abandonment, meaning the mother leaving the child's life after the child was in infancy. So when the child has a recollection. Um, and oftentimes the findings supported children blaming themselves for this absence. In this case, there was an interview done with a 40-year-old woman whose mother abandoned her at the age of 8. And she describes these feelings of intense guilt, thinking that in some way this must be her fault. Now, it's worth noting that even though these correlations were found, there is a limited pool of study to draw from as far as these maternal abandonment dynamics. There's a lack of U.S. centered studies. The studies are not as child centered as they could be. They rely on adult retrospectives, or they rely on um, these quantitative studies that don't necessarily involve the exact emotional outcomes of these children. And there's not a lot of targeted methods for research um, or targeted methods of treatment offered as a result of these research. Um, so there's no follow up as to how there might be a method of addressing the upcoming epidemic, so to speak, of parental smartphone usage. Next, I'd like to talk about paternal absenteeism. Now, many of the father focused organizations, such as the Father National Fatherhood Initiative shown here, do put out statistics involving fatherlessness, but those statistics are skewed given where the data is drawn from. So they will cite, focus on the family initiatives or research shows. However, in fact, the research is derived from just pure statistics, as in the case of the Census Bureau reviews, or they are coming internally from the organizations themselves. Now, despite those statistics involving absent fathers, there is also research suggesting that the scope of outcomes in children that have absent fathers is very varied. Um, there might be children that are in a strong maternal household and don't experience most of the cited aversive repercussions of not having a paternal figure present. However, given that, they might also have these conscious memories of the mother figure being absent for the workforce, as previously mentioned, but she's still present in the children's lives. As far as common factors that were found, there were no linked issues with cognitive development in children experiencing paternal absence. Um, there were strong correlated issues with social emotional development, particularly in young men. Um, but that might also be attributed to research bias as far as the approach that the data was derived from. And then some common factors listed among children that are in any regard experiencing parental loss, which we'll be repeating throughout this presentation, risky substance taking, risky sexual behavior, and possible issues with school completion. Now, I would like to take this time to talk about kinship care. So, the practice of placing children in care that is either family to them and within the legal foster care system, or family or community members that are not within the legal foster care system. Now, there are numerous positive implications to this practice of kinship care. The child will be in the care of allegedly familiar people for the child. It does heighten the chances of reunification in situations where that would be appropriate with the parents. It might maintain, familial cultural ties, and it could also increase the ability for a child to establish trust with the caregiver. Currently, as far as kinship care statistics, the US Census does cite over 2.5 million children being raised in kinship care. And of that statistic, the predominant group giving this kinship care is grandparents. Following that would be aunts, uncles, and then siblings. There is, however, a much smaller amount of research surrounding non grandparent kinship care as well as informal care. So there is a possibility of the outcomes in these cases being significantly skewed. Now, relative to organizations such as Grand Families and Kinship Support Network, there are a much, much smaller amount of children in foster care being raised by relatives compared to children in informal kinship care. Now, aside from the listed benefits, there are some notable concerns as far as kinship care. Families that are not uh, providing formal foster care will not be afforded the same legal resources. They also might not be afforded the same legal protections if somebody were to try to remove a child from informal kinship placement. There also might be some inadequate care standards if a family member is much older or younger and was never planning on having children. There are also some direct risks of kinship care. These, again, fall similarly in line with the other aversive effects of parental loss that have been discussed. Things such as mental health issues, substance abuse issues, and struggles with academic failure and perhaps social wellness issues. Now, some considerations to go over as far as children of absentee households. The primary research cited was centered around nuclear family structures. It doesn't necessarily account for modern family structures in which effectively one of these parental structure types might be unneeded. Um, there also was the lack of situational considerations for common therapeutic concerns. So, how we would then approach these different circumstances as far as offering therapy to the affected children. And there, again, I would like to note that there's a lack of child centered research involved in this portion. It was mainly retroactively or quantitative research. Now, for the second section, I would like to go into estrangement. And this is relative to children, so minors, whose parents are removed from their presence in a way that is not done in a willing manner. So, due to external factors, beginning with incarceration. So there are over 1 million adults that are incarcerated in the United States at any given time on average. And of this figure, there are approximately half of them which have children. And a good portion of those children are under the age of 5. This means that there are approximately as many affected children by incarceration as there are adults that are currently incarcerated, and that these adults may be incarcerated during these children's most formative years. Many of the children of incarcerated individuals that were gathered as a part of my review did cite these issues with feelings of missing out, feelings of their parents having missed out on these critical aspects of their life. In this case, the subject of the interview is describing how he had issues with his father not being there during the course of puberty milestones, such as shaving. And similarly, parents reviewed in these pieces were also talking about their fears and their conflicts with missing out on their child's lives. In this case, this individual's name was Joe Calderon, and he had been incarcerated since his child's birth, but then was later reunited with her as a teenager. And while they were very happy to be reunited with each other, there were some issues with the recent developments of their relationship, given the length of time and the period of time he was absent for. It's further important to consider the different factors that might be interrelated and even cascade off of each other as far as parental incarceration. So there might be issues with food security, situational security, and as far as whether or not a child might need to move school districts, depending on if the remaining parent can stay in the housing that they were originally in. Transportation security, is the parent that was arrested also the parent that drove the child to different locations? And all of these different factors then will contribute to the child's emotional, social, cognitive development. So, as far as considerations for training therapeutic practitioners, there does need to be a significant amount of training involved in at baseline how to unpack with the stigma that these children will be dealing with relative to the actions of their parents. And within that, there needs to be a stronger system of public advocacy for children of these parents, because these children are just doing their best with the tools that they are afforded to. And afforded to them. And given that there's also a need for consideration for children whose parents might be affiliated in gangs, as that might then contribute to the children's interactions with criminal activity as they grow up. Now, for transracial and transcultural adoption and foster care. So, to start, it's important to note that there is a disproportionate representation of children of color within the child welfare system. In September of 2018, out of the children in foster care, the percentages of these children that were Black, Hispanic, and mixed race were noticeably higher relative to the overall percentages of those races according to the census for that year. Now, in an effort to serve the overrepresented population of these children of color in the foster care system, there were a couple of pieces of federal legislation enacted. The Multi Ethnic Placement Act was done in an effort to prevent any sort of discrimination against fostering and adoptive families, regardless of race. But it also created these diligent recruitment practices in order to create a wider array of fostering families with which children had the opportunity to go with. In the 1960s, the Indian Child Welfare Act was created to promote Indigenous family integrity in child welfare scenarios following this extreme period of contention. And because of that, it was also created to provide more agency to tribal governments with regards to managing their own child welfare. Now, to focus first on Black transracially fostered and adopted children, there were some notable similarities amongst the studies reviewed for this. There were some issues and conflicts between class differences and racial insensitivity with adoptive and fostering parents. Children felt a immense pressure to conform among their peers, whether Black or white peers. Um, and the fostering or adoptive parents were, in some cases, stagnant in their ability to develop awareness of their child's situations relative to their skin color. Now, adoption advocate Daniel Boyce has some interesting points regarding his experience with transracial foster care and then adoption. He did go through a period as a child and as an adolescent where he began to question his identity. And in particular, as a child, he developed this sense of distress just simply because he looked different from his mother. So before he even developed an idea of racism. However, he also did mention that there are valid criticisms of transracial and transcultural foster care and adoption. For example, as mentioned previously, if the parent does not with the grow their understanding of their child's context, they can then create divisiveness with the child in their care based on that lack of growth. Ultimately, in his case, Daniel was fortunate enough that he had what would be referred to as a trauma informed parent. So this would be a parent who was able to take her experience, which she already had quite a bit of experience with foster care and adoption, and then adapt that experience to his individual needs and afford him the space that he needed to go through this journey of self discovery. Now, as far as the Indian Child Welfare Act, it did have some merits. The original intentions of it were to initially repair following the period of forcible removal of Indigenous children from households and communities. So the primary purpose was to rebuild trust and establish regulations in the way of tribal authority being the ultimate authority over child placement. However, the enforcement for this practice does suffer from a lack of funding, and there is, because of this, a notable statistical absence as to the status of Indigenous children in Indigenous foster homes or kinship care. And there also remain no nationwide enforcement methods or guidelines. Now, there are some notable benefits to Indigenous children being in foster care homes that are also Indigenous. Indigenous practices are very specific on a per community basis, not just on a tribe basis, but in terms of individual familial practices as well. So, by enacting kinship care for children, there is a certain degree of preservation of those practices and preservation of that niche community. There also might be locational security. If a child was raised on a reservation and was removed from their parents' care, it would be more advantageous for the child to then be placed with an indigenous family on the reservation, provided circumstances allow and are appropriate, as that would be a setting where the child is familiar. There are unfortunately numerous cases still of children being removed from indigenous care as a result of foster care and thus developing issues with their identity. In this case, you can see the author describing how she felt like she had lost out not only on a relationship with her maternal grandmother, who she was denied placement with, but also with her culture in the form of powwows and dancing. Still, it is important to note that Indigenous children do experience higher rates of kinship care relative to non Indigenous children. In this case, you can see a diagram of Indigenous child care where they are placed with either Indigenous individuals or kin. And in this case, you can see a comparison between Indigenous and non Indigenous children relative to whether or not the children are placed in kinship uh, care proper. So, what are some special considerations that we might offer for children that are in this situation of transracial or transcultural adoption and foster care? Shown here is another updated model of ecological systems, this time geared specifically towards Black children. And the essential premise is that it's highly necessary to support these children through the lens of understanding of the demographics that they are a part of. This means that to the best of our communal availability, we should make practitioners that can relate to these children's experiences more widely available to them. And additionally, make sure that practitioners are more informed of not just adoption trauma, but this particular type of adoption trauma that might arise. Um, and furthermore, there needs to be additional research done as opposed to just narrative collection into the effects of transracial foster care over adoption in order to provide better services as far as children that are in non permanent placement. And Lucas Boyce does offer three P's for understanding the mental health of these children. They are process, so understanding that there is no finish line in terms of how children will go through essentially this grief as they come to terms with themselves. Um, Pain, understanding that there will be some aspects of this process that are painful for children as they grapple with their identity, and ultimately patience as children go through these and support as you learn how to better assist the child through the length of time that they're going through this coming to terms process. Next, I'd like to talk about sexual orientation and gender identity or parental rejection related to those. Now, as a queer person myself, I have known individuals that have unfortunately suffered from this. Um, so it isn't difficult for me to imagine, but I wanted to include this quote from the director of a LGBT youth homelessness shelter in New York, um, relative to the severity that is ongoing as far as what will occur when parents reject their children to such a degree. Now, as far as LGBT homelessness at baseline, LGBT people have a much higher prevalence of lifetime homelessness. And in particular, here I wanted to highlight the slice of the pie that is the 20% of LGBT individuals who experienced some degree of homelessness before the age of 18 as children. Now, in part, some of the factors that lead to whether or not a child is in a status of being homeless as an LGBT youth is the differences in attachment that they might form with a parent following this coming out period. They might experience issues where a parent is outright abusive to them. They might have a parent that is supportive, in which case they would not hopefully undergo these adverse circumstances. Or they might have a parent that is only partially supportive, who enacts microaggressions but isn't overtly violent towards the child. Oh, these distance factors and resulting homelessness do create a number of notable risks in unhoused LGBT youths relative to non-LGBT youths. Most noticeably here, you can see that the exposure to discrimination and physical violence were particularly large, and that is related to the combination of the identity in addition to the vulnerable status of being an unhoused individual. Now, I did want to bring some faces to the literature being discussed here with this. This is Cyrus, who at the time of this interview was an 18-year-old trans male living in New York. And he describes having to leave his home based on abuse by his family and being placed in psychiatric institutions repeatedly. And since at the time of this interview he was 18, that means that his period of homelessness started when he was a minor. So, what can we do to help these children? Well, there's a number of things that can be done at the practitioner level. And most notably, in order to combat these adverse parent reactions, the goal is to offer education. Offering education to parents as to why children are going through these journeys, what can be best done to support them, educating children as to sexual safety and sexual education. And on a larger scale, a larger effort of public education as far as LGBT acceptance and homelessness acceptance and how to best support homeless populations at baseline. Um, Additionally, it's important to just recognize the difference in perspective that LGBT people come to, or LGBT children come to the table with, as far as how people treat them at baseline and how that can affect their day to day outlook on life. I did want to leave, however, on a positive note. There are numerous hundreds of cases, thousands of cases of parents that are not having these adverse reactions to their children's identities. And when we educate parents, when we provide them a scope of recognizing what their child is going through, they may be less likely to lash out and create these instances of insecurity in these children. Now, for the last section, I wanted to go over death as obviously a dominant factor in parental loss. When I started this project at the start of the semester, it was immediately following my mother's passing. And while I was able to seek solace in my partner who had lost their father as a child, um, the time frames of our losses greatly limited our capacity for true understanding. Because while I remember having a complete understanding of the grief cycle due to those around me and my psychology background, when my mother passed when I was 26, my partner had told me that for years it took them to get past, it took them years to get past the bargaining stage of grief after they lost their father at 5. And this was due to a childhood frame of reference and not understanding the permanence of things. Um, and within this, it's necessary for therapists and other mental health counselors to identify ways in which their personal experiences with adult parental death may be impacting the way that they're discussing childhood parental death with their patients or clients. Because even with good intentions, if there's a failure to reframe through the lens of the child, it might still create inaccessible care for that child. So, as far as resource availability from parents to children, there do seem to be some dominant resources coming from Dr. Bill Webster, who is executive director of the Center for Grief Journey. And while those resources do hold weight, The tracing back to a single individual does bring into question the diversity of resources that are available to parents trying to support their bereaved children. And additionally, the scientific literature relies upon adult retrospectives rather than consistently interviewing children at different points in time. So, interviewing children 20 years ago, 10 years ago, 5 years ago, versus creating an interview structure that just follows children over the same children over a particular period of time. Now, again, the numerous studies in of themselves did note this need for child-centered grief studies, as adult-centered approaches limit the efficacy of connecting with grieving children. Um, and additionally, the current child-centered grief studies, the studies that follow children on a chronological level throughout their grief journey, are not recent. According to the meta-analysis reviews, the cited studies had to be sourced everywhere from the 1990s to present, which, while I would like to think that was not that long ago, as far as research is concerned, there is a need for continuously updated research. Now, as far as notable school outcomes, the age at which a child loses a parent does seem to have some notable outcomes on both overall school attendance, as far as presence in the school itself, school completion at the high school and collegiate level, and school performance overall. In this case, I wanted to showcase a study that was assessing children's attendance of college following the parental death at specific points in their life. And the findings display that children, there are the least amount of attendance issues when the parent passes and the child is already in the age group at which they would already be beginning the college courses. However, within the considerations of the statistics involving children's completion and performance in higher level education following parental death, it's also important to consider how the point at which parents pass impacts the level of resources that children, even in multi child families, have access to. In this case, you can see here the black line signifies the death of the father, so the time point in which the father died. And sibling one had access to the resources from both parents, emotional and financial, for a much longer period than the second sibling. And for this reason, there may be younger siblings that are less inclined to complete their education if they had access to fewer resources following the parent's death. So there are some additional known factors that need to be reviewed as far as dominant areas of risk. Children who have lost parents do tend to be more at risk for stress related disorders, such as heart disease, chronic pain, or immunosuppression. And they also obviously are at greater risk of mental health issues. This is not surprising, but still warrants review as different situations of loss can cause different types of mental health issues. Here is an overview from one of the aforementioned studies going over the prevalences of different types of mental health issues over different periods of time following parental death. And you can see that overall, bereaved children do tend to suffer from higher levels of mental health issues, regardless of the time frame, with the only main exception being in alcohol use, where there seems to be somewhat even distribution. Some concerns that I had as far as this review were the methodology concerns of the studies. The studies primarily revolved around calling surviving parents following the release of a death notice by the coroner. And then following this, the parents would then have to agree to the study, and the parents would be interviewed on behalf of the children rather than the children being interviewed of themselves. Now, this is problematic in the sense that it's not offering a true childhood perspective, but also the data pool is significantly limited, and there's not really a way to have gotten around that with the methods used. Now, as far as indirect child effects that children might suffer, there are proximal risk factors that might be generated by the surviving parent. Um, this is covered in the Omega Journal of Death and Dying, as Alison Werner and Nancy Bianc review their piece, Holding Parents So They Can Hold Their Children. Um, it's important not only to offer support to children who have lost their parents, it's also equally important to offer support to the surviving parent in order to improve the possibility of positive support outcomes between the surviving parent and the children. Now, in my partner's experience, the surviving parent was their mother, and throughout my partner's upbringing, there was some relatively significant backlash as a result of their mother's unresolved grief. And this experience is not limited to them, and there have been numerous noted stress factors cited as a result of the surviving parent's bereavement. Things like lack of support within the child's own struggles with grief, emotional abandonment, not even in a malicious way, but in the sense of the parent is not capable of being emotionally present due to their grief. The parent may be non-responsive due to depression that may cause depression in the child. The parent may lash out in anger as a part of their grief, which leads to emotional abuse. And additionally, children may experience anxiety related to financial status if the parent that is deceased was also the primary income winning parent. So, as far as additional areas of exploration, there does need to be more exploration into the best ways to support surviving parents as the best method of accommodating children. Because even though there can be therapeutic support provided, ultimately there needs to be dual support provided, which means there needs to be further resources available to these parents. There additionally needs to be more consideration towards contextual factors of loss and how that might create different needs for the resources offered, as well as ensuring that parents have adequate ways of describing death at baseline to children in order to prevent these sort of adverse outcomes related to children processing the death very retroactively if there was no conversation about permanency or the nature of the state of death. So, in closing, I did find that the literature surrounding childhood perspectives rather than adult retrospectives is extremely limited across all of the subjects reviewed. In some ways, to be expected because it's difficult to gather data from children as a demographic, but it does also call into question the efficacy of the resources provided to the parents and practitioners with regards to addressing these topics, and especially with changes in practitioner methods over time. Um, while the social interviews do hold weight, without a larger degree of study, it's difficult to make any exact determinations as to best practices, and that will continue to be the case until better methods of data collection are formulated. I do believe that if once we seek out a greater level of understanding from a scientific standpoint, the therapeutic processes will follow. Thank you for your time.